So nowadays, the many pap smears are happening. So even they come in like high grade intraepithelial lesion, that is a precancerous stage. We are seeing those patients.
And what happens if there is diagnosed? Then what's the treatment? The excise?
They excise that area of cervix which has cancerous changes. And if the margins are negative, they keep the woman under follow-up. And if there are invasive changes, they'll go for hysterectomy.
Remove the uterus.
In the early stage. But if it is a later stage, the treatment is radiotherapy and chemotherapy. And most of the cervical cancer, even if they are like spread to the adjacent organs, it can be curable by radiotherapy.
Radiotherapy, okay.
Unless it is too advanced and it has spread to other organs, most of the women will do well with radiotherapy.
What is the earliest cervical cancer age that you might have seen?
35 years.
36. Okay, super. So for cervical cancer, we have a vaccine from 9 to 15 is the best time.
Yeah.
But they can have the vaccine even before 45 years of age. Okay, super. And then starting from 20 years, you do pap smear once every 3 years. This should be good enough to screen and prevent cervical cancer. I wish...
That is why the cervical cancer incidence are reducing nowadays.
Yeah. And I hope many people are adopting this vaccination series. And what is your take on your patient population?
Yeah, definitely. If a cancer is preventable, it is you should take initiative to vaccinate all our children. Even the male children can be vaccinated so that herd immunity develops and they'll be protected against penile cancers. So,
I forgot about the male child. Okay, so does the same thing apply to the male child as well?
Regarding vaccination.
Vaccine?
Yeah.
Oh, but we can do pap smear, so it's only vaccination. Same thing, 9 to 15 years, 2 doses. My son is going to become 9 next year. It is better to put this. Yeah. You have kids?
Yes, sir. I have 2 sons.
Did you? Are they?
No, they are 8 and 6.
So, but you will give HPV vaccine when he turns 9, and then 6 months later you will give one more.
Yeah.
It's good to know because I'm not involving your personal family here, but I'm just saying to raise awareness.
Yes.
As a doctor, you are recommending vaccination for your own kids.
Yeah.
Okay, well, that's good to know. So we talked about breast cancer. We talked about cervical cancer. Uterine cancer. Is there any screening?
In uterine, the most common cancer is endometrial cancer.
Endometrium is a lining of
lining of the uterus. So that most commonly comes in postmenopausal women, like after 50 years of age. And most of the time they'll present early with the bleeding, the postmenopausal bleeding. That means when you get bleeding, after 1 year after your period stops, you should get it checked. The checking is by first simple ultrasound scan, where we'll check the lining of the endometrium, how thick it is. If it is thick, we have to go for further testing. That is with sampling of the endometrium. So because it presents early, it is most of the time completely curable.
Yeah. So it's a symptomatic where you have bleeding where you are supposed to be because you're menopausal.
Even in premenopausal women, if you have like irregular bleeding and intermenstrual bleeding, like between periods, if you have a bleeding, it should be checked.
Will they have heavy bleeding?
Heavy bleeding can also be a symptom of endometrial cancer or endometrial polyps.
Polyps, yeah. Okay. Super. Kudos to what you do. Okay. It is not an easy job. I'm so glad that people are like you are raising awareness. So
Thank you, sir. Like I feel every doctor should raise awareness because it is an important clinical tool and you are doing it in a massive way. So that is really great.